Hello, everyone, and welcome to a webcast from Game Ready Mom Radio. And we are excited tonight to have Dr. Lydia Johnson. She's a board certified dermatologist in Richmond, Virginia, and we will be talking about the topic of tattoos. A lot of your young athletes are out there and they're watching these players on the court, and these guys are just tatted up. I mean, it's ridiculous from top to bottom for some of the players. And right now, the estimates are that 36% of young adults 18 to 25 have at least one tattoo, and 40% of adults 26 to 40. But we want to talk to Dr. Johnson about what's going on, if there are any things that you need to be concerned about, especially if your youngsters want to come to you and ask you for a tattoo. How are you tonight, Dr. Johnson?
I'm great, thanks. How are you?
I'm doing well. So you can understand why the topic will be important to our parents, right? And are you getting any parents now with those questions asking you?
Yes, as you know, we see it every day. The increase in tattooing is astounding. Actually, as you said, at least a quarter or more of young people under age 30 have at least one tattoo. So we do get quite a few questions about what to do about tattoo removal. I'm not a cosmetic dermatologist per se, but I do have to be knowledgeable about what the options are and where to direct my patients who do want tattoo removal. So um, I do steer them in that direction, but I also try to talk to people, especially young people, if they express an interest in tattoos or piercing, and talk to them about why they want it and things to consider beforehand. So some of those, of course, are with tattoos in particular. Tattoos are permanent. People tend to think of piercings as being more temporary, as they are, but tattoos do tend to be permanent. So it's careful to consider when to get a tattoo and where to get a tattoo and what particular type of tattoo to get. So those are some of the first things I have them consider.
Because a lot of people, I think, as you mentioned, don't really understand what's happening when they go and get a tattoo, that they're actually puncturing the skin and inserting the dye, right? Is that what's happening in the process?
That's exactly right. A needle is being inserted into the skin and the pigment goes right into the dermis, so the second layer of the skin, and it's there permanently.
What do you suggest that parents say to those children when they come to them at 16 and talk about, can I get a tattoo? Will you sign and say yes for me to do this?
I think probably the best thing for a parent to do initially is to say, let's think about it. Let's think about it for a period of time and discuss it again later. A lot of times it is an impulsive thing. Um, Sometimes teenagers do it under peer pressure. And as you said, they regret it later. And there have been studies that have shown that tattoo remorse is very high. Sometimes that remorse sets in within a few months of getting the initial tattoo. People may not act upon trying to remove that tattoo until years later, but the remorse sets in very quickly. And maybe thinking about it for a month or a couple of months might allow that teenager to reconsider. As we know, teenagers can be impulsive, and in a month or two, they may be interested in something else. So I think maybe not completely shutting down the idea initially, because we know that that can just sometimes make the desire even stronger, but maybe saying, let's consider it. And then parents also have some options and some leeway, because various states have various laws about when people can get tattoos. And so that's another thing that's in the favor of parents who may want their children to consider all of the options before making such a long-term decision.
So if you've gone ahead and you've done all the research or you've listened and you yield and let the student go ahead and get this tattoo, what are some of the risks involved with the process?
Well, the greatest concern, of course, is infection. It's very important to make sure that the person who does the tattoo is a reputable tattoo artist, not just a friend or someone on the street or someone who does them in their home. They should be in an actual tattoo parlor that's licensed. You should make sure you should actually evaluate and visit the parlor before getting the tattoo. Make sure that the tattoo artist wears gloves. Make sure that their equipment is sterilized. Needles and tubings that are used for tattoos should come out of sterilized packages before they're used on any individual client. The pigment trays should be used for individuals. The pigment tray should not be reused from one person to another, because that's an easy way to transmit infection, from more basic skin infections to even more serious types of infection like hepatitis C, even HIV. So a visit to the parlor firsthand is good. And then also asking questions when one goes to visit, asking about what their sterilization processes are, what they do to minimize the risk of infection, and looking for an actual license to do tattooing. And with granulomatous reactions, the skin, for an unknown reason, just develops a collection of inflammatory cells around the site of the tattoo. So that can be an isolated bump or a nodule within the tattoo. And then sometimes people are prone to forming keloids, particularly people of color are more likely to develop keloids where their skin has been traumatized. It's not always predictable, and that's a possibility. So if anyone has a history of forming keloids at ear piercing sites or other sites of trauma, then that's a red flag and a reason to reconsider having a tattoo, because they're more likely to develop a keloid at the site of the tattoo. So that's a second possibility, granulomas or keloid formation. Um, those are the major potential risks with tattoos. And again, the infections can be prevented to a large extent, but some of those other more random reactions cannot necessarily be prevented. Now, fortunately, there are things that can be done if keloids develop or granulomas develop. But they can alter the appearance of the tattoo and may result in a less than optimal result.
No. When you have these infections or or if a child has gotten a tattoo and they start to see the infection, what's the first thing a parent should do? Should they, because I know a lot of parents may try to just take care of it at home. What should they do?
Mm-hmm. That's a great question. Well, immediately after getting the tattoo, it's important to keep it covered with antibiotic ointment and covered with a soft dressing while it's healing for a period of probably about 2 weeks. That cover helps to keep it from being traumatized by clothes and other things. The ointment helps to minimize infection. But if those things are done and there is still a complication, the most important thing is to see a physician or a healthcare provider. As you said, sometimes people feel a sense of responsibility or even guilt, thinking that maybe they did something wrong or they went to the wrong person and that's why they're having a complication, when in reality sometimes complications just occur and by no one's fault. It's just the luck of the draw. And it's important to get prompt attention so that an infection can be treated right away and that things can be done to minimize undesired scarring or undesired effects on the tattoo. So immediate care by a healthcare provider is the most important thing, not try to take things in our own hands.
So there are some things, parents, that we just can't do. There are doctors out there like Dr. Johnson who can actually take care of it. They've been trained. They know how to do this. We don't. So make sure that you go straight to them if you see anything. I hear that the removal process can be very painful. Is that true?
Right. The best way to remove tattoos is with laser. And there are specific lasers that work best for removing the pigment in tattoos. It's not a quick procedure. It usually requires multiple treatments, at least 6 to 8 weeks apart. Laser has been described as feeling like you're being snapped with a rubber band repeatedly. So it's not a comfortable procedure. Um, it can be effective, and some of the tattoo dyes are more easily removed than others. You may have seen people who've had tattoos removed, and there's still some remnant of the tattoo. You know that one was there, though you can't see what it was, and that's because the black tattoo pigment is removed by laser most easily. The purples, the greens, the reds are a little more challenging, and again, they require multiple treatments. But it's a tedious process requiring multiple visits, and it is a little uncomfortable.
What about the cost? Because people don't think about the cost.
And it's costly, yes. It usually costs several $100s per treatment, so it's an investment.
Now, those are things that I feel like parents should definitely chat with their kids about, because if they do decide later on this is the best way, are there other treatments aside from laser?
Laser is the most effective tattoo removal option right now.
Okay.
Yeah.
There's nothing else. I really wish, though, if you hear of any chemical treatment, some simple way to remove them, if when that product goes on the market, I want to buy stock because
Yeah.
I have a feeling that in about 20 years, so many people will be rushing and looking for an option because right now I just saw another player, basketball player, his whole back literally is full of tattoos. And then a lot of people are talking about Colin Kaepernick, and he says he wants to be, the full, his whole body. He just believes it should be tatted up. And I don't know. Do you have any just any information about the psychology behind that? Because I don't understand it. I don't understand it.
Well, I think you and I are of like mind. I don't understand why people want to permanently disfigure their bodies in such a way. Um, there's so many other ways to express ourselves, from clothes to hairstyles, makeup, so many other ways that are temporary and allow us to change over time. And tattoos are so permanent. And I too find the psychology of it fascinating. I don't know of much research into it, and I'm sure that there is some going on now because of the prevalence and the explosion of full body tattoos now. Um, Something that would seem almost, at another time, would have almost seemed antisocial behavior is now so widely accepted. Um, like you, find it fascinating. And yes, I think in about 10 to 20 years, there will be a rush to find some other way to remove tattoos easily because I think that there will be a lot of tattoo regret.
Yes,
And,
definitely.
and another thing that I should have touched on earlier when we were talking about possible complications both of tattooing and piercings, especially relevant to athletes, is that with all of the physical activity that athletes do, these complications of infection and irritation and scarring are even amplified because of all the friction of the clothes and the hitting and the physical activity makes those complications even greater in athletes. So again, it's fascinating that that's the population that's getting tatted up the most, yet they're the ones at greatest risk for some of these complications.
So maybe the workout and the sweat would impact because if you're doing 2 a days in the summer in the heat, that may timing might be an issue for you, right? Maybe that's something that they should look to.
Right. Exactly. All of that friction and the heat and the perspiration and the dirt, all of that, none of that is good for the tattoo or the piercing.
Okay. So
Is it?
do have a player and you say yes, look at your calendar, see if there's a time period that they're going to be away from practice, away from, that whole exchange of bodily fluids up there because everybody's sweating and bleeding and, all of this stuff on the court right then. So make sure that maybe it's a time period where they will be off or it's, light practice or something like that so that you can be sure that they properly heal.
Exactly. Exactly. My take home message would be, like you said, especially if you have parents dealing with teenagers who are minors, if they want to make a permanent decision like tattooing, just ask them to take a little time to think about it and see how they feel in about a month because it is something that's permanent. It can be corrected and it can be lessened, but for the most part, it's permanent. And as you said, we change our minds a lot over time. So what we want to do at 16 is very different from what we'll want to do at 36.
Add another 10 years, 46. Whew, even those 10 years were huge, in a shift. So make sure that you're thinking clearly. Well, we want to thank you for joining us tonight, Dr. Johnson. I think the information will definitely be well received from our parents out there, and I know it's on the minds of a lot of parents who are concerned and may feel, as you mentioned, that generational issue, may feel a little bit confused about what's happening right now when their college kids come home and their backs are like, murals. And so we definitely want to thank you for joining us here on Game Ready Mom Radio, and we will be sure to have you back.
Thank you, Mia. It's been my pleasure.